Hi everyone, my name is Danielle Ruggieri, and I did my final project on sex addiction and how it affects our brain. How it starts. To start off, any sort of addiction can start from being hereditary, a person's personality, or a form of psychoactive drug. Especially with sex addiction, it is clear that there is a pleasure reward here. The addiction cycle. I chose this picture because I think it represents how the cycle of addiction starts. There's fantasy, which goes into ritual, acting out, and then shame. Definition. The definition of sex addiction is characterized as the compulsive need to indulge in sexual acts in order to receive a form of fix. This fix is, for example, a person with alcohol use disorder gets from a drink, or someone with opiate use disorder gets from using opiates. For some people, sex addiction can be highly dangerous and end up in unforeseen difficulties with relationships. For example, someone with a drug or alcohol addiction, it could ultimately end up with serious health problems. And for people with sex addiction, this can add strains in relationships and disassociation from partners. Characteristics. Characteristics of people with sex addiction, they often exhibit constellation of preferred sexual behaviors, so it's acted out in an obsessional scenario, just as a ritual. Experience periods of escalation and de-escalation, so high and low mood swings. Continue to act out despite severe consequences, for example, health risks, loss of family, as I said before, strain in relationships, possibly even your workplace or job. Have delusional thought patterns, rationalization, minimization, projection, reality distortion. Make repeated unsuccessful attempts to control their behavior. So this is saying that they're recognizing that their behavior is out of ordinary and they're trying to fix it, but they can't. Spend most of their time in obsession in a trance-like state, disassociated from reality, just like how that strains their relationships, especially with partners and family. Feel severe shame and depression, prone to suicidal ideas, behave in an abusive, exploitative manner, often violating own sense of values, live a double life shrouded in secrecy and dishonesty, and also go to extreme lengths to maintain their appearance, have high achievements, excessive. All of these sex addicts share all of these characteristics, which allows them to identify if they are a sex addict or not. So this is the reward cycle. The brain reward regions. Drugs of abuse converge by acting on a so-called brain reward region. This reward is very old from an evolutionary perspective and mediates responses to natural rewards such as food, sex, social interactions. As you can see, highly integrated limbic circuits innervated by dopamine neurons in the VTA. Symptoms of sex addiction. Chronic obsessive sexual thoughts and fantasies. So this is all day, every day. You could be in church and you can't stop thinking about sex. Compulsive relations with multiple partners, including strangers. Lying to cover behaviors. Preoccupation with having sex even when it interferes with daily life, productivity, work performance, and so on. Inability to stop or control the behaviors. Putting oneself or others in danger due to sexual behavior. feeling remorse or guilt after sex, experiencing other negative personal or professional consequences. I also put this picture here of symptoms of sex addiction. And as I said before, I will have relationship discord, change in unusual habits, um, use of prostitutes, substance abuse, health problems. Next, assessment and treatment of sex addiction. Comprehensive investigation of their sexual acting out behaviors, such as when, where, how much, how many, what type of pornography, and what kind of sexual fantasy. And these are the questions we want to ask them so then they can identify the start of their addiction. Sexual history, the quote, storytelling, helps them to face the reality of sexual and emotional trauma in their childhood and adolescence. Also, Sex Addicts Anonymous, inpatient sex addiction treatment centers, such as a 12-step center. Prolonged regular therapy. This is actually very critical because it actually can help you identify your trauma repetition and your reenactment, and maybe you can figure out why you are performing these acts. Facing the shadows, closed groups, therapeutic alliance based on trust, most important of all, empathy for their deliberating toxic shame, because this is an addiction and it's something that should not be taken lightly. There are 6 different types of sex addiction: biological, psychological, spiritual, trauma-based, intimacy, anorexia, and mood disorder. I put this picture here saying up to 1 in 25 people suffer from a sex addiction. With our first sex addiction is the biological sex addict. A biological sex addict is someone whose excessive masturbation and pornography viewing has hijacked the sexual response to attaching to images and fantasy. This person may have challenges with relational sex. So, for example, in a relationship, you become so reliant on pornography that when you are with your partner, it is not enough for you. Treatment would be biological sex addiction is treatable through changing your behavior and by retaining your brain to accept a new normal of remapping your brain's neural networks, which is also like restraining from pornography and trying to creating your brain a new way to view sex. Psychological sex addicts. Research shows that most sexual addicts have suffered from some sort of past abuse or neglect. They medicate the past pain in their souls with sexual acting out, which is actually their form of medicine. And a lot of times this can actually lead to further addictions with drugs or alcohol. Treatment would be psychological sex addiction is treated through first realizing that you are dependent on sexual behavior to treat your past issues. And that's a whole bottle in itself. Once you're aware of this, you must address the abandonment, abuse, or neglect at the source and not continue to self-medicate your emotional pain. So essentially, stop adding fuel to the fire. Spiritual sex addicts. A person with this type is looking for a spiritual connection in all of the wrong places. In recovery, we talk about our spiritual hole. This person tries to look for sex to fill the spiritual void and finds it doesn't scratch the itch over time. Treatment, spiritual sex addiction is treated through understanding that you are a spiritual being and your spirituality must be nurtured in the right way. Trauma-based addicts. The person with trauma-based type has experienced sexual trauma or traumas as a child or adolescent. This trauma becomes the major repetitive behavior in their addiction. Trauma-based sex addiction is treated through a several-step plan, such as like a 12-step or maybe sexual anonymous group. First, you need to realize your addiction is coming from the trauma and stop acting it out. Second, you need to identify what the trauma was and how it affected you. And I put this picture here, which kind of lays out a more depth way of trauma-based addicts. You have attachment injury, emotional and psychological injury, and then sexual injury. And all three of these aspects together is when you get a trauma-based sex addict. You have intimacy, anorexia, sex addict. This addiction is related to withholding intimacy, causing the spouse or partner to feel like a roommate. Treatment, intimacy, anorexia is treated by developing your emotional capacity, which allows you to open up to deeper emotions and be able to share your heart with your partner. Now we have our mood disorder sex addict. People with depression have chemical imbalances in adolescence or young adulthood. This person finds that the sexual release as a way to medicate or alter their present and chemical imbalance. Treatment. Mood disorder sex addictions is treated through professional help with licensed counselors and psychologists and possibly prescribed medications. And here are my works cited, and thank you so much for watching.